Hello, and welcome to the fifth Pharmacy 15. This week we will cover part 2 of the cardiac medications, focusing on the other medications. I will be reviewing 5 medications. 4 of the medications are primarily used during exercise and pharmacologic stress to reverse or ameliorate side effects or unsafe conditions. These include aminophylline, nitroglycerin, atropine, and beta blockers. The last medication, insulin, can be used during cardiac procedures, but it can also be used during FDG PET scanning. Let's start with aminophylline. Aminophylline needs to be considered from 2 perspectives. First, aminophylline is a medication that needs to be withheld because it can interfere with pharmacologic stress testing. Aminophylline and its myriad of theophylline cousins, such as Theodore, Theo24, methylxanthine, are all methylxanthines, and they are used to treat reversible airway disease such as asthma or other chronic obstructive lung diseases. Methylxanthines are competitive inhibitors of adenosine receptors, meaning that they block adenosine receptors. Interestingly, aminophylline has a higher affinity for adenosine receptors than does adenosine itself, thus providing effective blockade. Theophylline medications should be withheld 24 hours prior to vasodilator stress testing. However, in the cardiac PET world, where myocardial blood flow is measured, the evidence is pointing towards withholding caffeine and xanthines and theophylline longer. Aminophylline is also used as a reversal agent because it antagonizes adenosine at all adenosine receptors, including A1 and A2, and it reverses the effects of dipyridamole, adenosine, and regadenoson. Aminophylline causes smooth muscle relaxation, leading to bronchodilation. It also activates adenosine receptors in the central nervous system involved in regulating blood flow to the brain, which can cause changes in cerebral pressures manifested as headaches. Likewise, aminophylline has vasodilatory effects on the gastrointestinal system, which can cause nausea and vomiting. Aminophylline has a rapid onset and peak action. The liver metabolizes aminophylline and it has an elimination half-life of 8 hours. Interestingly, smoking and alcohol decrease the half-life, and oral contraceptives double the half-life of aminophylline. Aminophylline is indicated to reverse the side effects of vasodilators used in cardiac pharmacologic stress testing. It is contraindicated in patients with a known hypersensitivity to aminophylline. Otherwise, there are no specific contraindications. Aminophylline is most frequently used to reverse the side effects of dipyridamole due to the prolonged activity of dipyridamole in increasing the availability of extracellular adenosine. The standard dose is 125 to 250 milligrams slow IV. Aminophylline is rarely needed to reverse the side effects of adenosine and regadenoson because the half-life of adenosine is less than 10 seconds. When aminophylline is needed, lower doses such as 50 milligrams can be used. The side effects of aminophylline include nausea, vomiting, and headache. The next medication on our list is nitroglycerin. Nitroglycerin comes in a variety of forms such as sublingual nitroglycerin, nitrospray, nitrostat, isosorbide, which is also called Imdur or Isordil, nitroprusside, which is Captopress, and disoxazine, which is Cardura. Nitroglycerin is a vasodilator. Vasodilators work by relaxing smooth muscle cells within vessel walls, particularly in the large arteries, smaller arterioles, and in large veins. When arteries dilate, the flow of blood and oxygen increases because of a decrease in vascular resistance. Blood vessel dilation decreases blood pressure, lowering the pressure gradient against which the heart has to push, thus decreasing the heart's workload, which is also called afterload. In addition, nitroglycerin dilates veins more than arteries, which decreases cardiac preload, or blood return to the heart, thus decreasing the amount of blood the heart has to pump with each heartbeat. By decreasing the force of contraction needed and the volume of blood pumped, the heart needs for oxygen decrease, thus relieving chest pain or ischemia. Make sense? Nitroglycerin works in 1 to 3 minutes and it has a short half-life of 2 to 3 minutes. The duration of action is 30 to 60 minutes. Nitroglycerin is rapidly absorbed from the oral mucosa, which is why it's often given sublingual as a dissolvable tablet or as a spray. Nitroglycerin is used to relieve or prevent angina, and it can also be used chronically to treat congestive heart failure, hypertension, and myocardial infarctions. Nitroglycerin is contraindicated in patients with hypotension because it will make the blood pressure decrease even further. It is contraindicated in patients with hypovolemia and with increased intracranial pressure. It is also contraindicated in patients taking sildenafil, which is also called Viagra, or tadalafil, which is Cialis. The standard dose of nitroglycerin is 30 to 60 microgram tablets under the tongue or 1 to 2 sprays of 400 micrograms under the tongue. It usually gives relief within 1 to 5 minutes. The dose may be repeated in 5 minutes for a total of 3 doses. The tablet should not be chewed, crushed, or swallowed. Patients should be sitting down when given the nitroglycerin. The side effects of nitroglycerin include flushing, dizziness, hypotension, tachycardia, and headache. As a caregiver, you should avoid touching the tablets to avoid a headache yourself. The next medication on our list is atropine, which also has 2 uses in nuclear medicine. It can be used to increase heart rate during dobutamine stress testing, and it is also used during cardiac emergencies. I'll start with its use of dobutamine stress testing. Similar to exercise stress testing, the goal of dobutamine stress testing is to get the patient's heart rate to at least 85% of the maximum predicted heart rate to produce maximum coronary artery dilation. If the maximum dose of dobutamine is administered and the patient has not achieved 85% of the maximum predicted heart rate, atropine divided into doses of 0.25 to 0.5 milligrams up to 1 to 2 milligrams can be administered. Atropine is also a first-line medication for the treatment of bradycardia. As a side note, it is also used in surgery to decrease the rate of saliva production, but we aren't going to talk about that now. Atropine is an anticholinergic medication, which means it blocks the effects of acetylcholine, which is a neurotransmitter that slows heart rate. Therefore, atropine causes the heart rate to increase. Another name for an anticholinergic is an antiparasympathetic or a parasympathetic olytic drug. Atropine acts on both the smooth and cardiac muscles, and it improves the electrical conduction of nerve impulses in the heart muscle from the atria to the ventricles. It increases the heart rate by blocking the effects on the vagus nerve on the heart. When the vagus nerve is blocked, the sinoatrial node, or SA node, increases its rate of electrical discharge, and this in turn results in an increased heart rate. The peak effect with IV administration is 5 minutes. Atropine is indicated for severe sinus bradycardia or vasovagal reactions. Don't know what vasovagal means? Look it up. It can also be used to increase heart rate during dobutamine stress. Atropine's contraindications include known hypersensitivity, glaucoma, pyloric stenosis, thyrotoxicosis, fever, urinary tract obstruction, and ileus. It will not be effective in second and third degree heart blocks. The usual dose is 1 milligram by slow IV, and in cases of bradycardia, it can be repeated every 3 to 5 minutes until the desired heart rate is achieved or to a maximum dose of 3 milligrams. Side effects include tachycardia, urinary retention, impaired GI motility, hyperthermia, hot flush, dry skin, cardiac arrhythmias, and dry mouth. The next group of medications is beta blockers. And for the life of me, I can't think of any interventional use of beta blockers in nuclear medicine. They can be used to lower the heart rate in cardiac CT and reduce artifacts, but I don't have the time or the energy to cover that in this Pharmacy 15. That said, beta blockers are one of the medications that should be withheld prior to exercise and dobutamine stress testing. Beta blockers, also called beta adrenergic blocking agents or beta antagonists, are used for many different reasons and are common maintenance medications patients take. In general, beta blockers decrease heart rate and cardiac output, which lowers blood pressure and thus the heart beats more slowly and with less force. Thus, beta blockers are used to treat myocardial infarction, angina, hypertension, hypertrophic cardiomyopathy, congestive heart failure, cardiac arrhythmias, heart rate control, thyrotoxicosis, and glaucoma, and for the prevention of migraines. Beta blockers are also used to prevent future heart attacks in patients who have had a previous myocardial infarction. The anti-anginal effects of beta blockers result from the negative chronotropic and inotropic effects, which decrease cardiac workload and oxygen demand. The antiarrhythmic effects are due to the blocking of the sympathetic nervous system, which results in depression of the sinus node, function and slowed atrioventricular node conduction, and prolonged atrial refractory periods. The hypertensive effects result from the blockage of the sympathetic and nervous system with a resultant decrease in blood pressure due to the decreased sodium and water retention via the renin-aldosterone system. Beta blockers decrease heart rate and blood pressure at rest and during exercise, decrease cardiac contractility, decrease work capacity, and may cause false negative results on the ECG. They essentially limit maximal response to exercise, necessitating vasodilator stress. Using the 5 half-life rule of thumb for medication cessation before exercise or dobutamine stress testing, here are the withholding times for a couple of the common beta blockers. Atenolol should be withheld for 30 to 35 hours, metoprolol or Inderol 15 to 30 hours, labetalol 30 to 40 hours, and carvedilol 30 to 50 hours. We've now come to our last medication, which is insulin. And insulin is problematic for multiple reasons. Insulin is used in nuclear medicine studies to manage blood glucose levels and improve the quality of PET scans. In patients with diabetes mellitus, plasma glucose levels and serum insulin levels affect the biodistribution of F18 FDG. Increased glucose levels decrease the FDG uptake in tumors because FDG and glucose compete for glucose transport and phosphorylation by hexokinase. Hyperinsulinemia in response to elevated blood glucose causes rapid shunting of FDG to organs with high-density insulin receptors, such as skeletal and cardiac muscles, thereby resulting in altered radiotracer biodistribution and suboptimal image quality. Ideally, patients with hyperglycemia or hyperinsulinemia should be rescheduled, but that isn't always optimal. Therefore, various insulin protocols have been proposed to prepare patients using insulin to lower fasting blood glucose in diabetic patients. However, if the FDG is given before the complete physiologic neutralization of insulin, it may cause suboptimal image quality. And here's where we really get into the rub of the situation. All of the current guidelines are inconsistent, and there's a dearth of clinical strategies that address the optimal strategy for insulin use. The best I can do here is to say you should follow your institution's protocol, which will vary depending on whether it's a cardiac or oncology study. Patients with elevated blood glucose levels may sometimes be imaged after their glucose levels have been reduced by either an additional time delay or after injection of fast-acting insulin formulations. However, insulin administration within 2 hours of FDG injection can also result in reduced tumor uptake of FDG, resulting in lower contrast imaging. The ideal blood glucose level is less than 120 milligrams per deciliter. Contraindications to insulin administration is a hypersensitivity to insulin. Other than that, there aren't any absolute contraindications. The dose depends on the blood sugar level. However, insulin is generally given if blood sugar is greater than 200 milligrams per deciliter. The most common adverse effect is hypoglycemia, which can cause shaking, sweating, confusion, dizziness, and blurred vision. All right, so there you have the fifth Pharmacy 15 reviewing the other cardiac medications. During this video, I discussed aminophylline, a methylxanthine used to reverse vasodilator side effects, nitroglycerin, a vasodilator used to treat angina, atropine, an anticholinergic used to increase heart rate, beta blockers, which decrease heart rate and should be withheld before stress tests, and insulin used to manage blood glucose levels in PET scans, with the dosage varying based on institution protocols and the patient's blood glucose level. Now take a moment to review your notes, review the summary document I uploaded to Moodle, and work on the flashcards. You should focus on the mechanism of action and dosing for these medications, and make sure you can calculate the doses when appropriate. So I'll see you next time, well, sort of, when I'll review CT contrast. Reach out if you have any questions and keep studying.